Hey y'all, welcome to my channel. My name's Mila, and today we are diving into talking about diabetic peripheral neuropathy. I just wanted to let you know why I'm talking about this topic. I am a diabetes patient advocate, an integrative nutrition diabetes health coach, an author, a self-taught cook, and I live with latent autoimmune diabetes in adults. And really, what my channel and my website do is take away the shame and stigma that come with living with a diabetes diagnosis. And I cover topics like diabetes management, cooking, and self care from the perspective of someone living with the chronic condition. So if you like those things, stick around. Also, be sure to join my diabetes app. I have an app called Glucose Guide, and I consider it your personal diabetes assistant. It's an app that connects you to community, helps you with self-care, mental health, and living your best life with diabetes. Plus, I offer private and group coaching session circles, and the app is in Google Play and the App Store. So you'll get daily content like recipes, affirmations, and diabetes news all at your fingertips, which is pretty cool. Also, I am a small channel, small creator. I do all of this myself, and I live with a chronic illness. So any interactions on this video that you take help me know that you want me to continue producing this kind of content. So be sure to like and subscribe, and also leave your thoughts about this video whenever you get a chance. In today's module, we're going to talk about a few things about neuropathy. So we're going to talk about what diabetic peripheral neuropathy is. We're going to talk about risk factors for peripheral neuropathy. We're going to talk about signs and symptoms. We're also going to talk about what treatments are available, when you should consult a healthcare professional, and tips for prevention if you're not already living with peripheral neuropathy. So let's dive into it. So what is diabetic peripheral neuropathy? Diabetic peripheral neuropathy is a type of nerve damage that can occur when high glucose levels damage the nerves that your body sends signals to through the hands and feet. This can result in a lack of sensation or abnormal sensations like tingling, numbness, and burning. If left untreated, diabetic peripheral neuropathy can even result in the loss of limb function. Over time, at least 50% of individuals with diabetes develop diabetic neuropathy. Meeting target blood sugar habits does slow down the progression of diabetic neuropathy in patients with type 1 diabetes. However, the effects are more modest with those with type 2 diabetes. And so really we want to think about what are the symptoms and what are the signs of diabetic peripheral neuropathy. And in the early stages, you may experience no symptoms at all. You may not see anything happening. But as the condition progresses, you may start to experience numbness and tingling or pain in your hands, feet, arms, or legs. Other symptoms can include muscle weakness, difficulty walking, and a total loss of coordination and balance. And there are some risk factors for peripheral neuropathy. And several of these factors increase the likelihood of developing the complication. And these include the things that you're seeing here, and we'll go through them. So out of range blood sugars, having consistently high blood sugar levels can damage the nerves over time, and it can lead to neuropathy. The duration of your diabetes. So how long you have had diabetes really gives you a higher risk of developing neuropathy. Smoking narrows your blood vessels and reduces blood flow to your extremities, and that increases the additional risk of nerve damage. Obesity, excess weight puts additional strain on the nerves and can increase the risk of neuropathy. High blood pressure, so having hypertension, which is something that we as people with diabetes are more susceptible to, can damage blood vessels, impair circulation, and overall cause your nerves and your blood vessels to shrink. And then high cholesterol. So elevated levels of cholesterol can lead to narrowed blood vessels, which affects nerve health. And so there are some treatments available for diabetic neuropathy, and it's really important to recognize that there is no cure. There is no cure for it, but there are tons of treatments to be able to help manage the symptoms so that you're not feeling as much pain. So, pain medications, over the counter and prescription, can help relieve discomfort and tingling sensations. Lifestyle changes like regular exercise and a healthy diet can improve glucose control and further prevent nerve damage. And nerve decompression, for severe cases, medical procedures like this can be suggested by your doctor. And what nerve decompression is it releases the trapped nerves in the hands and feet and can alleviate pain and improve your motor function. There's also physical therapy. Physical therapy could also be recommended to help improve muscle strength and coordination. And a physical therapist can design an exercise program tailored to neuropathy and helping you manage symptoms and maintain your mobility. And you're probably wondering, like, when do you consult a doctor or a healthcare professional about this? And if you're experiencing any symptoms of peripheral neuropathy, it's important to consult a medical professional as soon as you're experiencing those symptoms. Early detection and treatment can help prevent further nerve damage and improve your overall quality of life. And if you've been diagnosed with peripheral neuropathy, there are several experts you can consult for assistance. You can talk to your primary care physician who will help you manage your blood sugar levels and may refer you to a specialist like a neurologist or an endocrinologist. In addition, physical therapists and occupational therapists can help with mobility and coordination issues caused by nerve damage. So when you lose feeling in your extremities and you're not able to use your hands and your feet like you were able to before, it's always helpful to seek out physical therapy that can give you strong exercises that can help you with improving that nerve function and reducing the effects of nerve damage. You should also schedule regular checkups with your primary care physician or endocrinologist and monitor your blood sugar levels to address any fluctuations that might be happening and might be attributed to nerve damage happening in your body. There are some prevention strategies for peripheral neuropathy. And so, to minimize the risk of developing peripheral neuropathy, you can work with your care team to implement some of these strategies. So, medication and blood sugar management, and working closely with your healthcare provider to manage diabetes effectively, following their prescribed medication regimen, and monitoring blood sugar levels regularly also helps. You want to be able to keep track of your blood sugars, keep track of your A1C levels, and aim for the targets that are recommended by your healthcare team. Having a healthy diet and maintaining a diet that's balanced and rich in fruits, vegetables, whole grains, lean proteins, fiber, pairing fat, fiber, and protein together to make blood sugar balance a little bit better, limiting the consumption of sugary foods and beverages, and talking with a registered dietitian to develop a personalized meal plan that suits your needs and helps control your blood sugar levels. Those are super, super important things to do. Working with a health coach also, like myself, between your doctor's appointments to be sure you're staying on the right track and getting accountability and a realistic perspective of diabetes management, super important. Regular exercise is also really important. So engaging in physical activities regularly, like brisk walking, cycling, swimming, any activity that gets your heart pumping, gets you moving, gets you working those big muscle groups. Super important, super helpful in balancing blood sugars. You want to consult your healthcare provider before starting any exercise program and follow their recommendations. If you smoke, then seek support and resources to quit smoking. Smoking cessation not only reduces the risk of neuropathy, but it just improves your overall health. You also want to get a routine screening and practice early intervention if possible. So, I want to know what your tips are if you're living with peripheral neuropathy about the treatment and what your experiences are like. Be sure to share them down in the comments below. It always helps others to learn that they are not alone. I also want to remind you again, that you're not alone. And in my app, Glucose Guide, it's a diabetes app that I just launched. I am so excited about it. We are cultivating a community of supportive and uplifting individuals. So if you want live events with experts, you want daily accountability check-ins, you want monthly wellness challenges with awesome prizes, you want evidence-based articles, diabetes-friendly recipes, the app is in the App Store and Google Play. It is free to download. And I welcome you to join our burgeoning community. I want this to be the best place for people with diabetes online. And I want people who are both newly diagnosed and really experienced in their diabetes management to be able to come together, share, and also uplift each other so that we all live better lives with diabetes. I also offer one-on-one coaching. So if you have a goal and you feel like you're stuck and you feel like you don't know where to go and how to do what you're doing, like reach out to me, because I am working to make health coaching accessible and affordable. And working with me on health coaching is super affordable, $30 a month. You get sessions with me. You also get access to the Glucose Guide app, which has courses. It has the ability for you to be able to get everything that you need all at once in your hands. Like I said, it's available on the App Store and the Google Play Store. And lastly, resources. So I always share resources. There is a blog on hangrywoman.com with this information. So if you like to read more than you like to listen, it's there for you. I look forward to sharing more with you. I look forward to you joining the Glucose Guide app, and I hope to see your progress. So thanks for watching. Be sure to like and subscribe if this video was helpful for you, and take care of yourselves. I'll see you in the next one. Bye.